because my purpose and passion is to help people like yourself, I invite you to get comfortable, tune out the rest of the world, and follow me to a place that may change your life and the lives of others around you. I'm Dr. J. Sordean, and I invite you to take the natural pathway to optimal health. Your optimal wellness and vitality is something that I take very seriously, and so should you. Do you ever wake up feeling just like your energy's not quite right? Or do you ever feel like your health is drifting downwards? Well, that is a reason why you might call the doctor. However, I would like to offer some alternatives to that so that your health and vitality is much more dependable, powerful, and steady. There are small things that you could change in your lifestyle that could have huge benefits. So I want you to feel really great, because great is what life is all about. I began my training in 1971 when I was the surgical assistant for my uncle in Indianapolis. I began getting interested in Oriental medicine when I started studying Tai Chi Chuan and Japanese language at college. The focus of this video is on you and your health. As I share my knowledge with you, I'm sure you will agree and understand more about your body and how your health works. With this knowledge, you will be able to have a greater control over how you live your life. My name is Dr. J. Sordean. I am a local representative for the Foundation for Wellness Professionals, and we are a national nonprofit that does lectures and community education around the country to talk more about natural methods to treat various illnesses and conditions. And not only am I an acupuncturist who's been in practice for more than 30 years, but I'm also a wellness consultant. So let me explain a little what that means. As a wellness consultant, I work with a variety of people in different areas. Oftentimes people will come to me after they've been to see 4 or 5 or 6 other physicians and haven't quite got the results that they needed. And so I do a thorough history and evaluation to see what may be going on that other physicians have missed, and then we go ahead there. Sometimes I can't help people, but many times I can when other doctors have missed something. I have, as I say, I've been in practice 30 years. And initially, as you can tell from the slides up here, you can see the pictures up here of me doing Tai Chi. I first started doing Tai Chi when I was 18, when I went to Earlham College in Richmond, Indiana. Anyone know Earlham College? Do you? All right. So I went there, and then I started studying Japanese that same year. So I continued studying Japanese, and I went to Japan, as you can see on the slides here, the Japanese. I went to Japan and I studied at Waseda University. I went back to Earlham, graduated from there with a bachelor's degree in Japanese and sociology. And then I went again back to Japan for another 1.5 years. So when I was in Japan, I started studying more about Tai Chi, as well as acupuncture and herbs. So I spent 2 years after that traveling through other parts of Asia, studying acupuncture and many other kinds of natural medicines. And as I was a low-budget traveler, backpack traveler. Anyone ever done that yourselves? No? Oh, you have. All right. So
along the way in a lot of different countries, I'd get a cut or I'd get this and that. And a couple times I got very, very sick. And so there were various natural methods that were helpful. I went to Western doctors and got a little better, but at one point I had a cut on my foot that was in Sri Lanka. I was swimming, it was a coral beach, and it cut. And in the tropics, things can develop. So I went to a doctor, got some gentian violet. Anyone know what that is? It's like a stain. Yeah, that's something. This is a very old method. So I used to use that on it, and it sort of helped, but didn't. So I was traveling, and then I went to a homeopath and didn't really follow through on that very long. And I continued traveling all along. And so I was going through India. My foot started getting a little worse, looking kind of nasty. And I was taking all these trains and other things, but it was a backpack traveler's budget. So I was not going first class. I was going with, the common people. So it was very crowded and dirty and people stepping on my foot. I was getting on and off trains. And so eventually I got through India and up into Nepal where I had a chance to relax. And so my foot was swelling up. It was not good. It was my left foot. And it was swelling and more infected. So I went to the hospital, the Western hospital there, to the emergency room. And I had to wait for like 8 hours. It's sort of like here. And had to wait a long time to get in. And they gave me some antibiotics. I took those for 5 days. It got better for about a week. And then it came back even worse. And I went to the hospital, checked in. They had to give me IV antibiotics. My whole leg was swelling. And eventually that went down. And then I left, but it still wasn't getting better. So I talked to some other travelers. And they said, oh, you should go see Dr. Manu Bacharya in Kathmandu. And he is an Ayurvedic doctor. So I went in. And he says, oh, okay. And he did my pulses and felt. And he says, okay, I know what it is. Don't worry about it. Just take these herbs and things and put this oil on it and these herbs and wrap it and keep it dry. So I did that. And I said, so what is it? He said, leprosy. Anyone here known anyone who had leprosy? No. Did you? Uh-huh. So anyway, so I had leprosy. I didn't care what he called it, as long as he knew what to do. And so after a month, it was cleared up, and I haven't had any problems since. But so there's, I understood from my own personal experience the power of natural medicine. Western medicine is great many times, but it doesn't always have all the answers. And so that's why I'm here, is because of my experiences with natural medicine. As you know, more than 50 million people in the U.S. suffer from arthritis. So how many of you here, by raising your hands, do suffer from arthritis or know someone who does? Okay, everyone knows or has it. That's approximately 1 in 7 Americans. And here it's more like, let's see, there's how many? 3, 6. We got 18 people here, so it's more like 18 out of 18 in this population, right? So it is a potentially crippling disease. And how many of you would say that it does cripple you and cause big issues in your life? Raise your hands again. Yeah, absolutely. Yeah. It can be horrendous. So nearly all Americans over the age of 50 show some varying degree of arthritis symptoms. So what is arthritis? Well, arthritis comes from the Greek word arthro, and that means joint. All right? And itis, meaning inflammation, exactly. So it's inflammation of the joint. Now I have a sharp crowd today. That's really good. So the warning signs of arthritis might be pain that occurs during or after movement or after extended periods of inactivity. Anyone wake up in the morning and feel a little stiff and all? So that's an example of that extended period of inactivity. The joints may also feel stiff and difficult to move. That's a sign. And skin around the joints may appear red, swollen, or warm to touch. I'm sure you all, from personal experience, understand what this is like. The most common form of arthritis is osteoarthritis. It involves the breakdown of the cartilage and bone at the joints, causing pain, stiffness, crackling, enlargement, and possibly inflammation. And so the joints are obviously at the end of the bones. We have the bone, then we have the end plate, then we have the cartilage over it. And so two surfaces of the cartilage rubbing against each other. So it's the cartilage and the end of the bone that start to erode. And one of the reasons for that can be obesity. because of extra weight and extra wear and tear on the joints because of pressure. Osteoarthritis can be divided into two types. The first is primary and the second is secondary. So primary osteoarthritis is the most common form. It is a slow progressive condition that usually strikes after age 45. It mostly affects the weight-bearing joints. So are these the weight-bearing joints up here? I mean, the head is about the weight of a bowling ball, but this isn't typically where we get osteoarthritis. We typically get it in the knees, the hips, the lower back, occasionally in the neck, and the fingers. Primary osteoarthritis develops when excessive stress is put on ordinary healthy joint tissues, or when normal amounts of stress are applied to an already weakened joint. So if someone, how many of you played sports when you were young? So you're playing sports, there can be a lot of heavy impact on the joint over and over, and that can stress it, and so later on those weakened areas can develop arthritis because they already have a tendency to have been inflamed and damaged. Studies, as I mentioned before, studies have shown that obesity and a family history of arthritis can put a person at greater risk for primary osteoarthritis.